This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, so I want to talk briefly a little about frostbite injury. We see that increasingly now, and there's been really a paradigm shift over the last couple of years with the advent of the utilization of tPA. So I wanted to talk a little bit about the indications for that and the data for efficacy. So picture on the top, would you characterize that as mild, moderate, or severe frostbite?
Moderate.
Moderate, severe, yeah. Okay, so one of the things that we'll talk about is patients who have evidence of mild frostbite just get supportive care, and patients who have evidence of severe frostbite within the time period of 24 hours would get advanced imaging and then consideration for tPA depending on results that they find. So in terms of characterizing the severity, in general, you can think of the PIP joint, the fingers or toes, as sort of the demarcating position. So if you have evidence of cyanosis after or attempted warming in a warm water bath, 37 to 40 degrees for an hour, and it's proximal to the PIP, that's considered severe. If you have multiple digits, even if it's distal, like this patient had, that's also considered severe. Those patients actually get admitted and they get an angiogram, and then if there's evidence of occlusion of the vessels distally, then they get tPA via an infusion over hours. In terms of efficacy, what would be your sense of how effective that is? It's very effective, yeah. Something around 70 to 80% of appropriately selected patients get salvage. So I included this large protocol here, but I summarized it with the patients who have severe frostbite get immediate angiography. Most of the data is less than 24 hours. This protocol included 48 hours. When we consult our burn team, they generally use that number, 48 hours, as long as the patient is reliable. So they get admitted, get the angiogram. The angiogram shows occlusion. They get tPA. The line stays in place, and they get another angiogram within 12 to 24 hours. So hopefully that gives you a sense of patients who have severe frostbite presenting within 24 to 48 hours, what type of workup and what type of efficacy you can expect.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.